Human right atrium, full detailed, explained in simple words. Introduction. The human heart is one of the most important organs in the body. It works day and night without stopping, pumping blood to every part of the body. The heart has 4 chambers, and one of these chambers is called the right atrium. The right atrium plays a major role in collecting blood that has already delivered oxygen to the body and sending it to the lungs for fresh oxygen. In this video, we will fully explain the structure, function, location, blood flow, valves, muscles, and importance of the human right atrium in easy and detailed language. What is the right atrium? The right atrium is the upper right chamber of the human heart. It receives deoxygenated blood, which means blood that has low oxygen levels after traveling through the body. The right atrium acts like a receiving room for blood returning from the entire body. Location of the right atrium. The right atrium is located on the upper right side of the heart, behind the sternum, the breastbone, above the right ventricle, next to the left atrium. It forms part of the outer border of the heart. Main function of the right atrium. The main function of the right atrium is to collect oxygen-poor blood from the body, to push that blood into the right ventricle. After this, the blood travels to the lungs to receive oxygen. Blood flow through the right atrium. Here is the complete blood flow process. Blood travels through the body. Oxygen gets used by body tissues. Blood becomes deoxygenated. This blood returns to the heart through large veins. The blood enters the right atrium. The right atrium contracts. Blood moves through the tricuspid valve. Blood enters the right ventricle. Veins connected to the right atrium. The right atrium receives blood from 3 major veins. Superior vena cava. This vein brings blood from head, neck, arms, upper chest. Inferior vena cava. This vein carries blood from abdomen, legs, lower body. Coronary sinus. This vein collects blood from heart muscles themselves. All these veins empty blood directly into the right atrium. Structure of the right atrium. The right atrium has several important structures. Thin muscular wall. The wall of the right atrium is thinner than the ventricles because it does not need high pressure to move blood. Auricle. A small ear-shaped pouch attached to the atrium that increases blood holding capacity. Pectinate muscles. These are parallel muscular ridges inside the atrium that help contraction. Interatrial septum. A wall separating the right atrium from the left atrium. The tricuspid valve. Between the right atrium and right ventricle lies the tricuspid valve. Its job is to allow blood to move forward, to prevent blood from flowing backward. The valve opens when the atrium, electrical system, inside the right atrium. The right atrium contains the heart's natural pacemaker called the sinoatrial node, SA node. This tiny structure produces electrical impulses, controls heart rhythm, starts every heartbeat. Because of this, the SA node is often called the natural pacemaker of the heart. Contracts and closes after blood enters the ventricle. How the right atrium contracts. The heart works in two phases. 1. Relaxation phase, diastole. Right atrium fills with blood. 2. Contraction phase, systole. Right atrium squeezes blood into the right ventricle. This cycle repeats continuously throughout life. Oxygen levels in the right atrium. Blood inside the right atrium contains low oxygen, contains higher carbon dioxide. This is because the blood already delivered oxygen to body tissues. Difference between right atrium and left atrium. Right atrium, left atrium. Receives deoxygenated blood. Receives oxygen-rich blood. Sends blood to right ventricle. Sends blood to left ventricle. Connected to Vena cava. Connected to. Diseases related to the right atrium. Several medical problems can affect the right atrium. 1. Right atrial enlargement. The chamber becomes enlarged due to high blood pressure in lungs, valve disease, heart defects. 2. Atrial fibrillation, an abnormal heartbeat where the atrium beats irregularly. Symptoms may include fast heartbeat, weakness, dizziness. 3. Congenital heart defects. Some babies are born with defects involving the atrium. Example, atrial septal defect, hole in the heart wall. Importance of the right atrium. Without the right atrium, blood could not properly return to the heart. The lungs would not receive blood for oxygen exchange. The body would not get oxygen-rich blood. It is a critical chamber for maintaining circulation and life. Pulmonary veins. Lower oxygen level. High oxygen level. Importance of the right atrium. Without the right atrium, blood could not properly return to the heart. The lungs would not receive blood for oxygen exchange. The body would not get oxygen-rich blood. It is a critical chamber for maintaining circulation and life. Amazing facts about the right atrium. It receives blood from the entire body. It contains the heart's natural pacemaker. It works continuously every second. It handles thousands of liters of blood daily. It is one of the first chambers blood enters when returning to the heart. Conclusion. The right atrium is a small but extremely important chamber of the heart. It collects oxygen-poor blood from the body and sends it toward the lungs for oxygenation. With the help of veins, valves, muscles, and electrical signals, the right atrium keeps blood flowing smoothly throughout the body. Every heartbeat begins with signals from this area, making it essential for human survival. Advanced detailed explanation of the human right atrium. Introduction. The right atrium is one of the 4 chambers of the human heart and serves as the main entry point for deoxygenated blood returning from the body. Although it looks smaller and thinner than the ventricles, it performs extremely important functions in blood circulation, heart rhythm control, and pressure regulation. The right atrium works continuously throughout life, helping maintain oxygen supply to the entire body. Basic anatomy of the right atrium. The right atrium is divided into 2 main parts. 1. Smooth posterior part. This section receives blood from superior vena cava, inferior vena cava, coronary sinus. The wall here is smooth because it develops from the embryonic sinus venosus. 2. Rough anterior part. This area contains pectinate muscles, muscular ridges. These muscles help strengthen atrial contraction. Shape and size. The right atrium has a cube-like shape, forms the right border of the heart, is larger than the left atrium in volume, has thinner walls than ventricles. Average wall thickness around 2 to 3 millimeters. The walls are thin because the right atrium only pushes blood a short distance into the right ventricle. Openings present in the right atrium. The right atrium contains several openings. Superior vena cava opening, located in the upper posterior region. Function: brings blood from upper body parts. Inferior vena cava opening, located in the lower region. Function: carries blood from lower body areas. Coronary sinus opening. This opening drains venous blood from heart muscles. Tricuspid valve opening, allows blood flow into the right ventricle. Internal structures of the right atrium. 1. Crista terminalis, a muscular ridge that separates. Smooth posterior wall, rough muscular anterior wall. It is an important anatomical landmark. 2. Pectinate muscles. These comb-like muscles increase contraction efficiency, prevent overstretching. They are mostly found inside the auricle. 3. Right auricle, a small pouch extending from the atrium. Functions: increases storage capacity, helps accommodate extra blood. Fossa ovalis, one of the most important structures inside the right atrium. What is it? A depression in the interatrial septum. Before birth. In the fetus, a hole called the foramen ovale exists here. Blood bypasses the lungs before birth. After birth, the hole closes and forms the fossa ovalis. Embryological development. The right atrium develops from primitive atrium, sinus venosus. Different embryological origins explain why some areas are smooth and others are rough. Blood pressure. Inside the right atrium. Normal right atrial pressure about 2 to 8 millimeters of mercury. Pressure changes help doctors evaluate heart failure, blood volume, pulmonary diseases, role in cardiac cycle. The right atrium participates in 3 phases. 1. Reservoir phase, collects venous blood. 2. Conduit phase, passively transfers blood into the ventricle. 3. Pump phase, actively contracts to push remaining blood. This final contraction is called the atrial kick. The atrial kick contributes around 20 to 30% of ventricular filling. Electrical conduction system. The right atrium contains major electrical structures. Sinoatrial SA node. Located near the superior vena cava. Functions: generates heartbeat impulses. Controls heart rate. Normal firing rate 60 to 100 beats per minute. Internodal pathways. Electrical signals travel through anterior pathway, middle pathway, posterior pathway. These pathways carry impulses toward the AV node. Blood supply of the right atrium. The right atrium receives oxygen through right coronary artery. Venous drainage occurs through small cardiac veins, coronary sinus. Nerve supply. The autonomic nervous system controls the right atrium. Sympathetic nerves increase. Heart rate, contraction force. Parasympathetic nerves, mainly through the vagus nerve. Slow heart rate. Function during exercise. During heavy exercise, more blood returns to the heart. Right atrium expands slightly. Heart rate increases. Blood flow accelerates. This helps deliver more oxygen to muscles. Clinical importance. Central venous pressure, CVP. Doctors measure right atrial pressure indirectly using CVP. Used to assess dehydration, shock, heart function. Diseases of the right atrium. 1. Right atrial hypertrophy. Causes: lung disease, pulmonary hypertension, tricuspid valve problems. Symptoms: fatigue, swelling, shortness of breath. 2. Atrial flutter. A rapid, abnormal rhythm caused by electrical disturbances. Heart rate may exceed 250 to 350 beats per minute. 3. Thrombus formation. Blood clots may form in abnormal conditions. Danger: pulmonary embolism. 4. Tricuspid regurgitation. The valve leaks backward. Result: blood returns into the atrium. Imaging techniques used to study the right atrium. Doctors examine the right atrium using echocardiography, uses ultrasound waves. CT scan, provides detailed structure images. MRI, shows soft tissue and blood flow. ECG, detects electrical activity abnormalities. Interesting scientific facts. The right atrium receives nearly all venous blood from the body. It contains the heart's primary pacemaker. Its contraction is essential for proper ventricular filling. It helps maintain circulation pressure balance. It works about 100,000 times every day. Right atrium versus right ventricle. Right atrium, right ventricle. Upper chamber, lower chamber. Receives blood. Pumps blood to lungs. Thin wall, thicker wall. Low pressure, higher pressure. Contains SA node. Contains trabeculae carni. Complete blood circulation pathway. Body, vena cava, right atrium, tricuspid valve, right ventricle, pulmonary artery, lungs, left atrium, left ventricle, body. Conclusion: the right atrium is far more than just a blood collecting chamber. It is a highly specialized structure responsible for receiving venous blood, starting heartbeats, assisting ventricular filling, maintaining cardiac rhythm, supporting overall circulation. Without the right atrium, the human cardiovascular system could not function properly. It is truly one of the most essential components of the heart.